Hi, I'm Lisa Leiter. In Chicago Business Today, skinny health insurance. United Healthcare has launched a new PPO plan aimed at mid-sized businesses trying to cope with spiraling healthcare costs. The core product leaves out 12 local hospitals and health systems. Cutting out more expensive providers can save companies as much as 15% on premiums. It could be the start of a trend among insurers as they try to cut costs ahead of national health reforms that could trim profits. I sat down with United Healthcare of Illinois Chief Executive Tom Wipfler to talk more about this plan. So how has the response been so far to the core product? Have you been able to retain some of the smaller and mid-sized companies that have seen their healthcare costs skyrocket?
Yeah, the response to core has been really strong. It actually has surpassed our expectations, and primarily it's because it resonates with the consumer. The employers who are struggling to provide affordable coverage to their employees now have another option from United Healthcare to do that. So we're very pleased with the response so far.
And cost, you had told Mike Elias, was not the only consideration in which hospitals you included in this plan. What else were some of the factors in how you chose which hospitals and doctor groups were in and which ones were out?
Sure. We had to engage in dialogue with each of the hospitals, and the discussions centered around things like price, the geography of where the particular hospital or system was located, and sometimes whether or not they historically have participated with other insurers' narrower products.
Well, some of the critics complain that some of the premier doctors and hospitals are not on this list. Northwestern Memorial, Children's Memorial Hospital. What would you say to those critics who say that you chose cost over quality?
The decision to include or exclude, as I mentioned, was made on a number of factors. For members of core, though, if they have a core benefit plan, they also have an out-of-network benefit that comes with that. So if they do need to go to a facility that's not in our network, they can utilize those benefits.
Do you think this type of product will help you to gain some market share against Blue Cross?
Well, our goal is to grow our business. Mostly it's centered around providing the market choice. The market needs to have choice. Employers and employees need to have offerings that are affordable and that can complement their strategy within their own business. You know, our job is to grow our business and keep our customers healthy, and we believe that core is going to do that for us.
Some of the hospitals that Mike Elias spoke to that were not included on the core list say that the payments you were offering were lower than their costs. Will they ultimately have to adjust to lower payments and become more efficient? What do you see as the future with provider payments and healthcare reform?
Well, healthcare reform has really been an opportunity now for us to take a look at the entire system. Transparency needs to continue to flourish within the healthcare system. Consumers need to be more empowered. And I think that when we move down those continuums, the goal of getting to a more affordable price point is attainable.
Did the economy play in at all into your decision to launch this product? People are paying much less for this core product.
Yeah, the economic challenge that we're faced with today has definitely contributed to the adoption of core. We'll continue to innovate what we can do on our side, and you know, you can never underestimate the competition. As we continue to innovate, as our competitors continue to bring solutions to the market, the consumer and the employer can benefit from a wider array of solutions for his or her business.
Can you share any numbers with us as to how successful the growth has been in this plan so far?
We're seeing nearly 4,000 members a month coming into the product, and we continue to believe that those numbers are sustainable and also that there's some upside to that in the future.
Okay, great. Well, Tom, thanks so much for joining us today. We appreciate it.
Great, thank you.
And that's this edition of Chicago Business Today. For more on this story, be sure to check out this week's print edition of Crain's or chicagobusiness.com. Thanks for watching. We'll see you tomorrow.